mother was very particular. So she encouraged me and she told me, she prepared me psychologically that I need to walk long distances for me to access antenatal services.
This season in India, I'm looking at how access to affordable healthcare is being addressed, but I'm also interested in other countries where progress is being made. In Zambia, Africa, for example, the UK government is funding a huge infrastructure project as part of Zambia's national upgrade to its healthcare system. The objective? 108 new health centres and 5 80-bed hospitals. Now, 20 of these health centres have already been completed, covering outpatient and inpatient care, and notably antenatal and postnatal services. Nursing Officer Felicitas and Sister Miriam, who I'm going to talk to now, are on the front lines at one of these new health centres in Lusaka province. Sister Felicitas, it's wonderful to talk to you. To start with, can you remember when you were a little girl what access to healthcare was like?
It was hard. It was very hard because only few health facilities were in existence. Only 46% people had access within 5 kilometers radius within the facility. But most of them, they were walking more than 50 kilometers.
And how have these new health centres improved the lives of the local community, aside from obviously shortening the distances that patients have to walk?
Yes, this infrastructure with this equipment, it can improve mortality rate. Let me give you an example in antenatal services. Before we were just using our physical examination, where yes, we are trained, isn't it? Because every pregnancy it is a risk, and for you to reduce those risks, you need to have ultrasound to be part of the package of antenatal services, because it will help you to make diagnosis very early, and when you manage these mothers well, it means you contribute to reduction of maternal mortality rate. So it has helped me professionally to be competent in my profession.
For the first time, seeing the cardiac activities, it was very exciting and very interesting.
Sister Miriam, you're on the front lines every day, working with pregnant moms, coming through the door day in, day out. How has this equipment changed the way that you work?
It feels good. It feels bad when you lose a woman, especially in labor. Thinking that I wish we had this machine to diagnose this problem area, it feels bad. And it can even take you for a week, you won't work normal. You'll be very low, but in this case, it feels good. When the first time I heard the probe, I was so happy with that anxiety in me. I was able to see the fetal heart, that's cardiac activities, and the presentation of the baby. So I was so happy because previously we just used to use our hands. We can feel, no, this baby is in bridge, this baby is in calf, this baby is in oblique, and to the fact that I'm not a midwife, I'm just a midwife by skill. That was the greatest day in my life. I'll never forget that day.
That's incredible. So is there an outreach service as well, so for pregnant mums that can't make it in?
Yes, we provide an outreach services. There are some distances that we feel it's too much for the mothers and maybe for the under 5. So we provide outreach services to them. So if in absence of motor vehicle, we use a bicycle. and a bike. But the greatest thing is you're with the ultrasound on your back.
So you jump on a bike with an ultrasound on your back to see mums that can't make it into the clinic?
Yes, because it's portable to carry it. Thankfully, we have this facility. I'm smiling, and I know my people in the community are also smiling. Thankfully, it is here now. I feel like it will be with me until death do us apart.